Welcome back to Dr. Liu's VCE Biology. Today's topic is disease challenges and strategies, as presented in the 2025 VCE Biology Exam. Imagine you're in the 2025 VCE exam. You see a question on monoclonal antibodies and RSV. You know the content, but do you know the mechanism? Statistics show that over half of students lost every single mark on this question because they missed one logical bridge. Today, we are going to build that bridge and fix your scientific pronunciation at the same time. Correct answer, A2. Reasoning. When a person is first exposed to a new antigen, there is a lag period, typically 5 to 10 days, before antibodies become detectable in the blood. This time is required for the innate immune system to present the antigen, and for B cells to differentiate into antibody-secreting plasma cells. In the graph, antibodies first start to appear around day 12 or 13. Working backward from day 12, an exposure on day 2 provides a realistic 10-day window for this primary immune response to initiate. Day 13, option B, is when the concentration is already rising, meaning the exposure must have happened earlier. A is incorrect. While antibodies may be absent on day 0, it isn't because cytotoxic T cells are inactive, it's because the adaptive immune system hasn't encountered the specific antigen yet. Furthermore, cytotoxic T cells kill infected cells directly and do not produce antibodies, B cells do. B is incorrect. T cells do not differentiate into plasma cells. B cells are the cells that differentiate into plasma cells to secrete antibodies. C is incorrect. On day 15, the concentration is approximately 1 unit. On day 35, the concentration is roughly 2 units. While 1 is half of 2, this is a distractor based on a specific moment in time. The more biologically significant statement regarding the secondary response, option D, is the intended focus of such questions. D is correct. The graph shows a secondary immune response starting around day 33. This response is much faster and produces a significantly higher concentration of antibodies, peaking at 7 units, compared to the primary response. This is due to the presence of memory B cells created during the first exposure, which respond rapidly upon re-exposure. Correct answer, A. Reduce the spread of pathogens between members of the population, protecting susceptible people. Logical breakdown, the triple strike approach. The barrier effect. When a high percentage of the population is vaccinated, most individuals have specific immunity. This means the pathogen constantly hits a wall because there are fewer hosts available to infect. Breaking the chain. As the transmission pathways are blocked, the overall spread of the disease within the community slows down significantly. Indirect protection. This creates herd immunity, which provides indirect protection to susceptible people, those who cannot be vaccinated for medical reasons, such as being immunocompromised or having severe allergies. Analysis of distractors, VCE key concepts. Why B is wrong. Herd immunity is achieved by decreasing, not increasing, the transmission of the pathogen. Why C is wrong. Vaccination triggers active artificial immunity. The body is actively producing its own antibodies and memory cells. Passive immunity involves receiving pre-made antibodies, like an antivenom, which does not provide long-term memory. Why D is wrong. While high vaccination rates can reduce the chance of mutation, they do not prevent antigenic shift, which is a major genetic recombination. Furthermore, vaccination does not remove all human hosts, it simply makes those hosts immune. Correct answer, C. Factor: members of the human population traveling the world and returning home. Classification: emergence of a new pathogen in the population. Logical analysis. Defining emerging new: this refers to a pathogen that is completely new to the human population, e.g., a zoonotic leap, or one that has existed elsewhere, but is appearing in a new geographical area for the first time. Global travel is a primary driver of this, as individuals can bring a pathogen back to their home country where it was previously unknown. Defining re-emerging: this refers to a known pathogen that was previously under control, often through vaccination or sanitation, but is now increasing in incidence again. Evaluation of options. A is incorrect. Increased access to medical treatment generally decreases the spread of a pathogen. It wouldn't be a factor causing a re-emergence. B is incorrect. A decline in immunization rates would typically lead to the re-emergence of a known disease, like measles or polio, not the emergence of a new one. C is correct. International travel allows a pathogen to jump across borders into a naive population, qualifying it as an emerging disease in that specific population. D is incorrect. Improved sanitation and living conditions help prevent disease. They do not cause re-emergence. Correct answer, D. An antigenic shift, producing a new viral strain. Logical explanation. In VCE biology, we distinguish between two types of viral changes. The key phrase in the question is immediate development of a new vaccine, which implies a massive, sudden change that makes existing immunity useless. Antigenic drift, option A: these are small, gradual mutations. While they eventually require vaccine updates, like the annual flu shot, they don't usually require an immediate, emergency development of an entirely new vaccine platform for a naive population. Antigenic shift, option D: this is a major, abrupt change in a virus, often through recombination of genetic material from different strains. This produces a new subtype with antigens that are so different that most people have no immunity at all. This is the mechanism that causes pandemics and requires a brand new vaccine immediately. Why the other options are incorrect. B is incorrect. Bacterial mutations leading to antibiotic resistance are a major health issue, but they are treated with different antibiotics or phage therapy, not vaccines. Vaccines prevent infection. Antibiotics treat an existing bacterial infection. C is incorrect. If there is no change in antigen shape, then the existing memory cells and antibodies would still recognize the pathogen. No new vaccine would be needed because the lock and key fit remains the same. Respiratory syncytial virus, RSV, is a common virus that can infect people of all ages. RSV can lead to the hospitalization of infants. RSV is easily spread via respiratory droplets from those infected. In late 2024, the Australian federal government announced an initiative for pregnant women to receive a vaccine to combat RSV. A single dose of the vaccine is recommended at between 24 and 36 weeks of pregnancy. The vaccine contains two different proteins normally found on the surface of RSV. Identify. Natural passive immunity. Justify. It is passive because the baby receives pre-made antibodies, IgG, from the mother across the placenta. The baby's own immune system does not produce its own antibodies or memory cells in this process. VCE strategy tip. When students see a question about mother to baby, they often get confused between the mother's immunity, which is active artificial from the vaccine, and the baby's immunity, which is passive natural. Using your triple strike logic to separate the source of the antibody from the method of delivery will help them immensely. Suggest one reason. A booster vaccine is recommended to ensure a high concentration, titer, of antibodies is circulating in the mother's blood during the specific window of pregnancy, 24 to 36 weeks. Explanation. Over time, the concentration of antibodies produced by the mother after the initial vaccination will naturally decline. By receiving a booster, the mother's memory B cells are reactivated to undergo clonal expansion and differentiation into plasma cells, ensuring there is a sufficient supply of antibodies to be transferred to the second baby to provide effective protection after birth. Economic benefit. One economic benefit is the reduction in healthcare costs associated with the hospitalization of infants. Explanation. By vaccinating pregnant women, the incidence of severe RSV infections in infants is lowered. This reduces the financial burden on the public health system by decreasing the need for expensive neonatal intensive care, emergency department visits, and long-term medical treatments for respiratory complications. This official marking guide is a goldmine for understanding how the VCAA, Victorian Curriculum and Assessment Authority, expects students to frame social and economic arguments. It highlights a very common trap. Students often get too generic or biologically incorrect when trying to be practical. Here is a breakdown of the key takeaways you can use to sharpen your students' exam technique. 1. The specificity rule, avoiding generic traps. The guide explicitly rejects the statement, "Children survived so they could contribute to the economy." Why? It's too far-fetched and abstract. The lesson, in VCE biology, an economic benefit, must be proximal, meaning it needs to be a direct result of the medical intervention. Stick to immediate costs like hospital beds, medication, and workforce participation, sick leave. 2. The biologically incorrect trap. Many students argued that vaccinating the mother saves money because the child won't need a vaccine later. The error, passive immunity, from the mother, is short-term. It does not create memory cells in the infant. Therefore, the infant will eventually need their own active immunity of vaccination to stay protected long-term. Teaching point. Remind students that passive equals temporary. You aren't buying one, getting one free for life. You are just buying the infant a shield for their first few vulnerable months. 3. Ethical and social context, page 12 of study design. The mention of the key science skills is crucial. In the 2022-2026 study design, students aren't just tested on the how of biology, but the so what. Economic factor, cost effectiveness, prevention versus cure. Social factor, the burden on the public health system and the well-being of families. Girls and boys, don't get distracted by the fancy name monoclonal antibody. Think of it as a designer antibody. It has the same variable region as a natural one, and it does the same jobs. It tags, it clumps, and it blocks. Just remember, it targets the antigen, not the whole pathogen, and it works outside the cells. Mechanism of monoclonal antibodies. Monoclonal antibodies, such as nirsevimab, provide artificial passive immunity by acting as a targeted defense against the RSV virus. Explanation. Once injected, these specific antibodies bind to the surface proteins of the RSV virus, neutralization. This binding prevents the virus from entering and infecting the host's respiratory cells, and can also flag the virus for destruction by other immune cells, opsonization, thereby limiting the viral load and reducing the severity of the symptoms in the infant. Look at this pie chart. 54% of your peers missed these marks because they thought monoclonal antibodies were only for cancer. Don't be that student. Just treat them like highly specific super antibodies that tag the virus for destruction. Mention neutralization and opsonization, and you're already in that top 26%. 1. The standard toolkit argument. Students often struggle because they think mAbs require a special explanation. Encourage them to use the two-action rule. If they can name any two standard antibody actions, they get the marks. Action 1, neutralization, binding to the RSV antigen to block it from entering lung cells. Action 2, opsonization, tagging the virus for phagocytes to eat it. 2. The anatomy of an answer precision. The marking guide showed that VCAA is very picky about terminology. You can show them this bad versus good comparison. Avoid, the antibody binds to the virus and kills it. Antibodies don't kill, they tag or block. Avoid, the antibody binds to the protein. Too vague. Use, the mAb binds to the specific antigen on the RSV surface. 3. Addressing the extracellular gap. Explain that the reason infants need these injections, especially if the mother wasn't vaccinated, is to catch the virus before it hides inside their cells. Point to emphasize, once the virus is in the respiratory cells, mAbs lose their primary effectiveness. This is why timing, high-risk periods, is everything. Identify one way. Implementing rigorous hygiene practices, such as regular hand washing and sanitizing shared surfaces. Justification. According to the provided context, RSV is spread via respiratory droplets. Washing hands or disinfecting surfaces acts as a preventative measure that removes or neutralizes the virus particles on skin or objects. This breaks the indirect transmission chain, preventing the pathogen from being transferred to the infant's respiratory tract. VCAA isn't just looking for a correct word, they are looking for a mechanism. If you choose hand washing, don't just say it's good, tell the examiner it stops the droplets from reaching the baby. And always stay ethical. Never suggest a strategy that breaks the bond between a mother and her child. Avoid circular logic. Do not simply say it reduces the spread. That is restating the question. You must explain how the action stops the virus, e.g., acting as a physical barrier, or disrupting the viral transmission path. Contextual accuracy. The strategy must match the transmission method mentioned in the stem, respiratory droplets. Strategies for blood-borne or food-borne pathogens will not receive marks. The ethical boundary. While quarantine is a biological control strategy, isolating an infant from their mother is considered unethical and inappropriate in a social and medical context. The core mission. This walkthrough deconstructs the 2025 VCE Biology Exam, specifically the Disease Challenges and Strategies module. We move beyond simple answer keys, focusing instead on the mechanical how of immune responses and the linguistic how of scientific communication. High-stakes insights. The antibody paradox. We address why the majority of students failed to earn marks for monoclonal antibodies mAbs. By applying the two-action rule, neutralization and opsonization, we bridge the gap between cancer therapy and infectious disease defense. The economy of health. We move students past generic economic answers toward precise, mechanism-based justifications. We explicitly debunk the myth that maternal passive immunity replaces the need for infant vaccination, a critical biological boundary for VCE success. Slide 2, Q29 reminds students that the lag phase isn't just a delay, it's the time required for clonal selection and differentiation. Slide 9, Q6a use the source versus method breakdown. Source equals natural placenta, method equals passive, pre-made antibodies. Slide 12, Q6d use a bold visual or note about the extracellular nature of antibodies. They are the border patrol, not the internal police. Slide 16, takeaways end with your triple strike logic, identify the component, explain the mechanism, and link to the specific context. If you need my help, please add me on WeChat or WhatsApp and send me an email. Thanks for your attention. Please note Dr. Liu's VCE Physics channel, Dr. Liu's VCE Chemistry channel, and Dr. Liu's VCE Biology channel.